After pregnancy coverage, brought to you by Eligibility, Policy, Innovation, and Community Support within IT Innovation and Customer Experience Administration with the Washington Healthcare Authority. In this presentation, we will provide background information on postpartum coverage and why it was extended, the eligibility criteria on how to qualify, scenarios on when the coverage begins and ends, screenshots of the updates made in the Washington Healthplanfinder system, and finally resources on where you can find more information about this program. Program background. Prior to the expansion of postpartum coverage, pregnant individuals on Washington Apple Health Medicaid received 60 days of postpartum coverage that began the first of the month following when their pregnancy ended. After the 60 days of postpartum coverage, individuals had the option to recertify their coverage for another Apple Health program. If they were found ineligible or no action was taken by the individual, the postpartum coverage would automatically transition to an additional 10 months of family planning only services, which offered a limited benefits package for contraceptive and family planning related services only. The American Rescue Plan Act was passed in March 2021, allowing states to extend postpartum coverage. For this extended coverage, the scope of services and benefits must remain the same as prior to April of 2022 and not be less in amount, duration, or scope. The requirement also stated that in order to receive 12 months of the extended coverage, the individual would need to be on Medicaid during the time they were pregnant, and coverage would begin the month following the last day of the individual's pregnancy. July of 2021, the same year that the American Rescue Plan Act was passed, the Washington State legislation passed Senate Bill 5068, directing the Healthcare Authority to extend postpartum coverage from the current 60 days to 12 months and to be implemented by June of 2022. The bill also stated that those not on Apple Health during the time they were pregnant may still apply for this program if they apply within the 12 months of their pregnancy end date. In March 2024, Senate Bill 5580 was passed. This allowed up to 5 additional days of hospitalization stay for the birth parent and increased the federal poverty level income limit from 193% to 210% for all Medicaid, Apple Health, pregnancy and after pregnancy programs, effective November 1st, 2024. The result of these changes: individuals who are on an Apple Health program and report they are pregnant will automatically transition to after pregnancy coverage for 12 months after the end of their pregnancy. Individuals not on Apple Health during their pregnancy may still apply for after pregnancy coverage within 12 months of their last pregnancy ending. Both the pregnancy and after pregnancy coverage programs have an increased income limit of 210% of the federal poverty level as of November 1st, 2024. Eligibility. For individuals who are active on an Apple Health program and report that they are pregnant, they will automatically transition to the postpartum extension. For this automatic transition, a pregnancy must be reported as well as a pregnancy end date to guarantee the postpartum extension or after pregnancy coverage. After pregnancy coverage will begin the first day of the following month the pregnancy ends, regardless of any pregnancy outcome, and coverage is continuous for 12 months, regardless of a change in income or household size. Individuals who are not on an Apple Health program may now apply for after pregnancy coverage. To qualify, the individual has to have had a pregnancy in within 12 months. They must reside in Washington State, have countable income equal to or below 210% of the federal poverty level, and not be active in another Apple Health program. Immigration status does not apply, and coverage begins the month the individual applies and is found eligible. Depending on when the individual applies for after pregnancy coverage, they may not get a full 12 months of coverage. For example, if the individual applies 6 months after their pregnancy has ended, they will have 6 months left of after pregnancy coverage. We will have a scenario to share with you in the next few slides. Income guidelines. To qualify, income must be at or below the income standard of 210% of the federal poverty level, and the numbers listed in the chart below include a 5% income disregard. For example, a two-person household for pregnancy or after pregnancy coverage can have a combined gross income of $3,662. To apply or report a change. For those who are not currently on an Apple Health program and looking to apply for after pregnancy coverage, or for those who are active on Apple Health and need to report a pregnancy, can do so by going online, using Healthplanfinder app, by phone, submitting a paper application, or applying or reporting a change in person. You may also learn more by visiting our website at hca.wa.gov/apply-or-renew-coverage. Covered services. Covered services. After pregnancy coverage is comprehensive coverage that mirror the services received during the individual's pregnancy that include, but are not limited to, physical health visits, such as primary care, specialty care, urgent care, or emergency room visits, behavioral health services, such as mental health or substance use disorder treatments, oral health, and hospital services, both inpatient and outpatient. Scenarios. Scenario 1. Active on Apple Health. Maria is a 32-year-old U.S. citizen with income at 130% of the federal poverty level. Maria is 3 months pregnant in May of 2024 and applies for and is enrolled in the Apple Health Pregnancy Coverage Program. Maria's pregnancy ends on the last day of November 2024. After pregnancy coverage is automatically approved beginning December 1st, 2024 and will end November 30th, 2025, allowing a full 12 months of after pregnancy coverage. Scenario 2. Not active on Apple Health. Ava had a pregnancy that ended on May 15, 2024. Ava was not on Apple Health during the time they were pregnant and can apply for postpartum coverage if it's within 12 months of their last pregnancy end date. Ava submits a Medicaid application with an income of 180% of the federal poverty level on June 15, 2024. Because Ava applied for after pregnancy coverage the month after her pregnancy had ended, her certification period for after pregnancy coverage will be a total of 12 months beginning June 1, 2024, and will end on May 31, 2025. Scenario 3. Active on Apple Health. Sydney is a pregnant, non-qualified person who applies for and enrolls in Apple Health for pregnant individuals on June 1, 2024. Sydney has reported the estimated due date as December 15, 2024. Because after pregnancy coverage starts the month after Sydney's pregnancy would end, The certification period for Sydney's after pregnancy coverage will begin on January 1, 2025 and will end December 31, 2025. Scenario 4. Not active on Apple Health. Jennifer is a non-citizen who applies for Apple Health in November 2024. Jennifer answers yes to having had a pregnancy end in July 2024 and attested to having income of 194% of the federal poverty level. As of November 1, 2024, the pregnancy and after pregnancy income limit increased from 193% to 210% of the federal poverty level. Jennifer qualifies for after pregnancy coverage because she had a pregnancy end within 12 months and the income is under the 210% of the federal poverty level. Jennifer's certification will begin November 1, 2024 and will end July 31, 2025. After pregnancy coverage will be approved for 9 months of continuous coverage only since Jennifer's pregnancy end date was July 2024. Outreach. Outreach efforts. In June 2022, when after pregnancy coverage was implemented, the Healthcare Authority completed outreach to intended audiences through social media posts, radio ads, publications such as posters and flyers, and different community-based outreach. These efforts continue today to educate citizens across Washington state on after pregnancy coverage and the new federal poverty level of 210% for all Apple Health pregnancy-related programs. You can learn more by visiting our webpage at hca.wa.gov/APC. After Pregnancy Coverage Flyer. The After Pregnancy Coverage Flyer can be found online under Form 19-0076 and is available in 15 different languages. An 11 by 17 poster is also available to display in lobbies or waiting rooms. This is under HCA Form 19-0077 and is also available in 15 different languages. This poster also includes a QR code that directs clients to the After Pregnancy Coverage webpage for more information. Program impacts. What are some of the impacts of after pregnancy coverage? Evaluation in the process, so data claims maturity, evaluation of design and analytic approach, how are people being enrolled into after pregnancy coverage, the service utilization, and the cost. Early review of data suggests the eligible population has a lower utilization of available services when looking at comparison groups. While we know the utilization is lower than anticipated, the outreach efforts continue to educate and promote the Apple Health pregnancy and after pregnancy programs and the services available. Opportunities for improvement. Through an evaluation process, it was found that within the eligible population, there is a lower than anticipated utilization of after pregnancy coverage services. The Healthcare Authority has identified additional areas of improvement to include a request for a wide partnership amongst all that work with or support pregnant individuals. Providers and care teams can encourage clients to report their estimated due date and/or the end of pregnancy date to ensure a seamless transition to after pregnancy coverage. Providers and care teams who have direct contact with clients can also assist in informing the new mothers or those who've had a pregnancy end in the last 12 months of the available services and how to access them. This also allows a warm handoff to a primary care provider when clients are discharged from pregnancy care. System updates. Pregnancy questions. Under the Answer Questions about your household section, all pregnancy details will be captured here. Pregnancy questions continued. An individual will be screened for Apple Health for pregnant individuals and after pregnancy coverage when answering the following question. Is any household member on this application pregnant or had a pregnancy in the previous 12 months? Select yes if someone in your household is pregnant with an expected due date or was pregnant within the last 12 months. Additional questions are displayed once yes is chosen, including the person who is pregnant, the due date, and number of babies expected. If the household member who is pregnant or previously pregnant is not seeking coverage with Washington Healthplanfinder, these questions will not display. If you answered yes to is any household member on this application pregnant or had a pregnancy in the previous 12 months, additional information will be needed. For pregnant individuals, provide the date that the pregnant household member expects to give birth. If unsure, provide your best guess. If you answered yes to the had a past pregnancy question, you will be asked to enter the pregnancy end date. Household members who've had a pregnancy in for any reason in the last 12 months may qualify for after pregnancy coverage. Change reporting or renewal. When an individual previously reported a pregnancy end date and reports a change or completes a renewal, the following questions will appear. Check the box for any household member who is pregnant or has been pregnant in the last 12 months. Do you need to make any updates to this information? If yes is selected, additional questions will appear. Is this household member currently pregnant? If no is selected, what date did the pregnancy end? If the household member who is pregnant or previously pregnant is not seeking coverage with Washington Healthplanfinder, these questions will not display. Change reporting question. The change report pregnancy-related question has been updated. When an individual answers yes in Washington Healthplanfinder, it will navigate to an additional household information page, and the updated question for pregnancy will automatically default to yes. Correspondence updates. Both the Apple Health Auto Renewal Form, or EE008, and the Apple Health Renewal Action Required Form, or EE009, have both been updated to include the question, was any household member previously pregnant in the last 12 months, and the last day of pregnancy date. This will automatically default to yes if it was previously answered. Resources. GovDelivery. You can subscribe and stay connected with GovDelivery by visiting the website at public.govdelivery.com/accounts/WAHCA/subscriber/new and signing up for general information and updates, or by choosing your topic of choice. You can also follow us on social media or the Blue Sky app. Resources. For more information on pregnant individuals, you can visit our webpage at hca.wa.gov/apple-health-pregnant-individuals. For more information on after pregnancy coverage, you can visit hca.wa.gov/APC. Also, our stakeholder training and education website at hca.wa.gov/stakeholder-training. Thank you for attending today's webinar on after pregnancy coverage. We would like to provide this opportunity to be able to answer any questions that you may have. You can also reach us by emailing the eligibility policy team at hcaa.eligibilitypolicy@hca.wa.gov.